the secretary to call the roll.
Ryan, Parker, Barnett, Blackman, Blackwell, Blunt, Kaufman, DeBar, Fillingang, Frazier, Harkins, Hobson, Horn, McMahon, Parks, Polk, Tate, Wiggins. We have a quorum.
Mr. Alston is here with the Attorney General's office to discuss with us House Bill 1392. So in deference to his schedule, if you're willing to come up and explain the bill to us, I'll call up House Bill 1392. And if you can just find a microphone and sort of explain to us what the bill does.
Thank you, Chairman Bryan. Members of the committee, Gregory Austin with the Attorney General's office. I appreciate the opportunity to talk a few minutes about this bill. 1392 creates a registry for those who have been convicted of the crime of abuse, neglect, or exploitation of a vulnerable person within the Department of Human Services. I'll go through a couple important provisions of the bill, and I'm happy to take any questions as well. You'll see in the bill, there's a couple different sections that require rulemaking authority, but essentially, like I said, this bill creates the vehicle to have a registry for those who have been convicted of abuse, neglect, or exploitation of a vulnerable person. It requires a care facility to search the registry for their employees or for people that they're looking to hire within a care facility. You'll see subsection 7 also allows a member of the public to have an opportunity to have a chance to search the registry under certain circumstances and conditions. We thought it was important that not only, those who work for a care facility, but for those outside of a care facility in the public who may need a caretaker for a family member, something of that nature, to have the opportunity to be able to search the registry. This is something that we saw Alabama pass called Shirley's Law recently last year. This is something that we thought was important that the state of Mississippi take a look at. And that is essentially the bill before you. And I'm happy to take any questions about it and, go into deeper into any other provisions of the bill, but that's essentially what it does. So.
Do members of the committee have questions? I don't, Senator Fillingang.
Thank you, Mr. Chairman. Just one, is the Department of Human Services, are they in favor of this or have any position on this that you're aware of?
I'm sorry, what did you say, Chairman
The
Fillingang?
Department of Human Services, do you know if they have any position on this bill?
I know that we've had general conversation, just sharing it with them. I think they're generally aware of it. I mean, I don't want to speak for them as their opinion on it, but I know that we've shared the idea with them and they're aware of the bill. So.
Thank you, Mr. Chairman.
Further questions? Is there a motion on the bill? There's a motion, title sufficient to pass. Further debate? If not, all in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Thank you, Mr. Alston.
Thank you, Chairman Bryan.
We'll now go to House Bill 249. Senator Blackwell has promised me that if I will recognize him, that's all I need to do. Senator Blackwell.
Thank you, Mr. Chairman. This bill comes to us at the request of the Department of Health and Department of Revenue, and it does exactly what the short title says. It extends repealers for them. In this case, it's IT services going from June of 23 to June of 24, and for the Personnel Board from June of 23 to June of 26. They've had significant hurdles trying to hire staff, and so that's the reason for the extension. That's an explanation of the bill. I'll yield for questions.
Are there questions? Debate? If not, the vote occurs on Senator Blackwell's motion, title sufficient to pass. All in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it, and we'll report that bill. The next item on the agenda is House Bill 259, Medical Radiation Technologist Defeat Repealers on Registration Statutes. This is a repealer bill. The repealer would be extended until 2028. There are technical changes concerning the definition of nuclear medicine, which appear on page 3. That's what the bill does. There's a motion title sufficient to pass. Questions? If not, the vote recurs on the motion title sufficient to pass. All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. House Bill 522 is another repealer bill. This is the existing law on individual on-site wastewater disposal systems. This too would extend the repealer until 2028. There's a motion title sufficient to pass. Further debate? Questions? If not, the vote recurs on the motion title sufficient to pass. All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. House Bill 854 is a bill concerning marriage and family therapists. The change to the existing law is on lines 53, which provides for another credential that would allow you to practice this. It's a master's or doctoral degree in marriage, which seems to me a high enough standard to comply with the educational requirements. Is there a motion? Is a motion title sufficient to pass? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. House Bill 1039 is a bill concerning occupational licenses for individuals who are members of the military or married to them. It's similar to some other legislation we have passed, which is an attempt to allow those who are here on military status to practice in this state if they have the authority to practice in another state. The thrust of this bill is to extend this to veterans and spouses of veterans. There's a motion title sufficient to pass. If you're ready to vote, all in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. We'll report that to the Senate. House Bill 1158. And once again, Senator Blackwell has promised me if I will recognize him, that's all I have to do. Senator Blackwell.
Thank you, Mr. Chairman. 1158, we were submitting a strike all. This is actually still a work in progress. So would request that we get this out of committee so that Representative Yancey and I can continue to work on the bill. But let me just go over a couple of high points, I guess. On lines 134 to 139, this is to provide that no patient shall be required to submit to a drug test prior to receiving a certification for medical cannabis card. Lines 140 to 144, it authorizes a practitioner to assist a patient in registering for a registry identification card. Some of the folks, particularly the elderly, do not have the internet skills, and so we're letting the doctor's office do this. Lines 188 to 191 to authorize any topical cannabis product that is purchased by a dispensary from a licensed processor that is not ingested by the liver. So these are topicals, these are ointments, sprays, these are nothing that can be digested or inhaled. And again, part of this is we've got so few patients to kind of direct some additional business that other states have to some of these cannabis dispensaries. Lines 368 to 377. The department has done a few things inconsistent with the intent, I'd say, of the statute. One of the things they did is they allowed a cultivator to have a secondary location. And so we're trying to correct this without penalizing that applicant. So the language in line 7, on 368 to 377 addresses that. One of the other issues that came up was we had a 1-year time frame for a dispensary to open from the time they made application. But with a lot of the communities opting out, then opting back in, some of these folks have been delayed. And then therefore, by the way the statute was written, they lose their license. So all this does is extend it from 12 months to 18 months. Lines 624 to 628. This deals with the farm bill that deals with the hemp products. So we're going to allow dispensaries to sell CBD products in their store as well. Lines 965 to 967 to prohibit any state agency or board from implementing any rule, regulation, policy, or requirement that is contrary to the provisions of the Medical Cannabis Act. Unfortunately, we've had some of these agencies not exactly be user-friendly and have picked some of the more challenging rules and regulations from other states to implement. And a number of other agencies are then wanting to pile on and add their own rules and regs. There was a provision in the original draft that said that information pertaining to any investigation was confidential. We've changed that to say it's up to the public disclosure once all the appeals have been exhausted and the judgment is final. So that's pretty much all the high points. I'll yield for questions.
Questions for Senator Blackwell, Senator Horn?
Thank you, Mr. Chairman. Senator Blackwell, could we go back to line 178? And could you explain what's going on there about practitioners?
So some of the other agencies we deal with, like I just mentioned, have kind of piled on with their additional rules and regs. And this is one of those that deals with that.
And I've heard that there's been a lot of slowness of rolling out this program because the legislature did not anticipate how labor intensive for the Department of Health and maybe even Department of Revenue setting this program up has been. Can you talk a little bit about how we're addressing the getting a more efficient system put in place?
Well, to some degree, I agree with you. It has been a slow roll, but at the same time, contrary to that, I think they've done a great job in the short time frame that we've given them. And again, that time frame was pretty much prescribed by Initiative 65 being struck down. We wanted to get something in place as quickly as possible. So there are some resource issues that the department faces. Human resources is one of those. And again, I think they have, in some cases, not having people with prior experience, they're picking maybe some rules and regs that might not be as user friendly or that we would like.
And have they made any requests to your knowledge to the legislature about the human capital as well as the budgetary constraints? And at requesting any additional funding or staffing pins for this program?
I'm sure the funding is in their budget request.
Thank you, sir. Thank you, Mr. Chairman.
Senator DeBoer.
Thank you. Thank you, Mr. Chairman. Senator Blackwell, on line 10.2, we're exempting from disclosure from the Public Records Act, it looks like. Any investigations, suspensions, revocations, what's the rationale for not releasing this to the public?
Which lines are you?
10.22.
Okay. Unfortunately, there's been a lot of back and forth between most likely cultivators, people snitching on each other to be more direct about it. So what has happened is the media has gotten some of that and has then is airing these things out in the public while there's an active investigation going on. So I think the language from the House was to keep that down and kind of till everything was done. But the way their initial wording was, it wasn't to be disclosed at all. So we're going to make it available once all the appeals have been exhausted.
I mean, I can see that there's an investigation ongoing that should be, I guess, closed or refrained. But if there's a fine issued, suspension, revocation,
That needs to
That's already
public.
been-
That needs to be made public.
that's not what,
It will be after the conclusion of all the appeals.
why after the appeals? Why not when the initial determination is made?
Because you don't know if it's true or not.
Well, if the fine's been issued or suspended, then
And,
apparently
and,
the investigation revealed it was true.
and you may be, and the investigation may be in the court of public opinion instead of where it should be with the agencies.
So who makes the determination whether there should be a fine, suspension, revocation?
That would be the department.
The Department of Health conducted an investigation, issued a ruling, and their investigation could be flawed? Is that what you're saying?
It's possible.
And then let me go to the next section. On line 1170, it says the addresses of prospective and licensed medical establishments are confidential, exempt from disclosure on the Public Records Act. Why do we have to restrict disclosure for there as well? What's the rationale for that?
I'm told by counsel that it's basically to protect the establishment so that any bad actors can go in and take any of the product out of the dispensary.
Oh, so no one could break into the facility and sample
So
any whatever.
that's correct.
All right.
And I'll work on a better explanation on the floor.
Thank you, Senator. Thank you, Mr. Chairman.
Anyone else? Senator McMahon.
Couple things. I want to go to line 595. So what this says is if someone is or building out or constructing a facility and they don't finish that within 18 months, that their license shall be revoked.
Correct. And it was a 1 year prior, or the original language said 1 year.
Well, Senator Blackwell, what's been going on, what I'm hearing is that the Department of Health, depending on who the person is that's doing the inspection, is interpreting the rules differently. And in some cases, some people have been have been prepared and ready to go to work, and they can't get an adequate answer. So I called the Department of Health myself and asked for the person in charge, the permitting, and asked to see the regulations. It took me 5 phone calls before they ever returned my phone call. I had to call the director and get him to intervene. I've seen a lot of written opinions. I've seen a lot of written instruction from different Department of Health officials that contradict each other. Have you seen any of that?
I've not seen it, but I've heard complaints about it.
I know this is a complicated process and it's a new industry, but I really think that the Department of Health should have to honor any written instruction they've already given. I think they should have to honor that to keep business people from being out hundreds of thousands or in some cases millions of dollars. How do you feel about that? Because they keep changing the rules.
I will admit, to my knowledge, again, going back to complaints, there have been inconsistencies with information they've provided these cannabis providers.
Do you think maybe we should construct some type of amendment requiring the Department of Health they have to honor any written instruction that they've already given?
That's possible to consider. And like I said, this Representative Yancey and I are still working on this, so I'd be happy to get with you and look at your idea.
I appreciate that. But I don't want to wait. I don't want to spend a lot of the committee's time, but if you would be open to hearing that and maybe putting that somewhere in the bill, that way they can't keep changing. Once they give something in writing, you can plan on that. Where in the bill does it deal with air or lighting requirements? Does it have that anywhere in here?
It does.
Okay. So currently, it's my understanding that some people are bringing air in from the outside and they were told they had to run it through a filtration system. And then is that, do you support that?
I'm not aware of that situation.
And what about lighting requirements? Are there there's no lighting requirements in here of any kind requiring only artificial lighting? Natural lighting is also allowed?
To my knowledge, that's correct.
Okay. Thank you, Senator Blackwell. Thank you, Mr. Chairman, for answering my questions.
Anyone else? Senator Blackwell moves title sufficient do pass.
Yes, I do.
Uh,
Committee strike all.
Vote as, well, okay, so I suppose we should, this title sufficient do pass as amended. Are you ready to vote? All in favor, say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. I have had distributed to the committee House Bill 557. This is a bill we passed. It went to appropriations. Appropriations has amended the bill and returned it to us. The Appropriations Committee merely added a reverse repealer to the bill. I've always found the actions of the Appropriations Committee, particularly under its very fine leadership, to be very well taken. And it's certainly my recommendation to the committee. Wait, is Briggs in here? Oh, well, why am I going
We
through
had
all
another
that?
meeting.
Is there a motion title sufficient do pass as amended? All in favor, say aye. All opposed, ayes have it. House Bill 1222 is a bill that was authored by Representative Creekmore, who is actually with us today. I know that Representative Creekmore and some others in the House have done a great deal of work on this. I do want the committee to know that is just as is the case with Joe Burra, Representative Creekmore is really from Amory, although he's temporarily living in some nearby town. We have been struggling in this committee, and the legislature's been struggling with trying to improve mental health services in the state of Mississippi. As you know, we've passed a bill and established a conservator who has the authority and the duty to go about the state and look at the ground, tell us what's going on, report back to us. The federal court has a monitor. Although I'll say this about the federal legislation, if you look at the panel from the Fifth Circuit, if I were the Justice Department, I would be more concerned about Rule 11 sanctions than getting anything out of that panel. But nevertheless, all of this attention that's being focused on the problem, I believe, has resulted in a lot of positive steps. This legislation is another significant step in that direction. And so just going through the bill briefly, it would, the amendment would require that every county and municipal law enforcement agency would provide first aid training to all officers on or before 2031. This is important training, but it's sort of first aid. It's not intensive training. And then on or before July 1st, 2025, each agency would have an officer who is trained to be a crisis intervention team officer, with a provision that if you have fewer than 5 employees of your law enforcement agency, you could essentially have an agreement that another agency would perform those services. This is a very important function. This is a place where you can really do some good. What happens over and over again is there's a crisis situation. Someone who's got mental illness and is having a difficult episode. And if a law enforcement officer goes there and the law enforcement officer doesn't have the proper training, bad consequences can occur. The training for the crisis intervention officer is very intensive. It's about 40 hours, but this will result in there being somebody on the ground when there's an episode to go and be literally the first person that gets there. And I just think this will avoid a lot of difficult situations that have occurred all over the country. Another provision is a provision that's showing great success, which is to have an individual in each mental health district, or more than one individual, who can serve as a court liaison. What happens is, and you know this goes on back home, if there's a family that has a family member and they don't know what to do, they go to the chancery clerk. Whether that's appropriate or not or whatever, that's where they're going. And much of our mental health operation is based on a legal framework which hasn't made sense in decades. So what these people do is there is somebody who is trained, who knows what services are available, who knows what alternatives are, to come to the chancery clerk's office and meet with the family at that moment while they're there. And so, you know, the best solution here may not be an involuntary treatment. There are all these other things you can try. In the counties where this is going on, this intervention at this point is having a dramatic effect in the reduction of involuntary commitments. And one of the measures that I think we would all like to focus on that's clearly understood is the number of involuntary commitments around the state. I'll just say in this case, as in a lot of other cases, part of what has to take place is there has to be some place for the poor soul to go. There has to be some place to get some services, whether it's a crisis stabilization unit, whether it's a hospital, whether it's a family member who can can help if there's some support, whatever the other options are. If those options aren't there, it doesn't do any good to have a diversion to some theoretical thing that doesn't exist. But it's showing great promise, and I think that will be successful. The Board of Mental Health now has no term limits, as it were. Terms are 7 years. This would provide that basically after you've served 2 terms for 14 years, that you could not be reappointed without a break in service. Some of the regional mental health commissions have had just terrible, terrible problems with their handling of funds. This bill would require that each commission have a CPA to manage the affairs and to provide a statement of their situation at the end of the year, which can be audited. In section 7, if there is unanimous consent to make this change, I would strike the sentence beginning on line 459, which would require a clerk or a sheriff to be appointed, and to replace it with the language that simply says who may be a clerk, a sheriff, or a deputy. And without objection, we'll make that change in the strike all that's before you. This is what the provision does. Generally speaking, the supervisors appoint members of the mental health regions. One of the good things that's taking place around the state is the supervisors are being made more aware of the importance of these positions, and I think more attention is being paid to who's on the board. But this would make clear that the individuals who are appointed serve at the will and pleasure of the supervisors. It would say that they could appoint a sheriff or a clerk or a deputy if they want to. But it would also provide that in each region, the chancery clerks would get together and name either a chancery clerk or a deputy to be a liaison. The sheriffs would get together and name either a sheriff or a deputy sheriff to be a liaison, so that there would be someone at the board meetings that knows what happens at the chancery clerk's office, who knows what happens at the sheriff's office, who can tell the board members, this is what's going on in the real world. There's also a requirement that the board members attend an orientation session. I'm told that session may be accessed on YouTube if it's not possible to attend the actual meeting. There is a provision concerning paying for services for people who have been committed. Right now, generally speaking, if I'm committed in a certain county, that county has to pay for my care. So there's resident of County A who's committed by County B, and County B is having to pay for services for a resident of County A. This would say that the county of residence, County A, has the responsibility for paying for that. It also provides that this provision will not take place until June 21st, 26. It also provides that this provision will only take place when the director of mental health certifies that there are sufficient facilities available at a reasonable cost and a reasonable location for each county. So this is an attempt to try, again, to focus on the need to have some contracts, some real world arrangements for taking care of people who are committed and when there is no room for them in the end. The solution for all of this, once again, is to have more services available on the local level, to have more opportunities for alternate services. Having the delay until 2026 and then having the certification by the director, I think goes a long way toward alleviating, if not completely resolving difficulties that some counties may have. But I think this is a step in that direction. There's a provision that on a quarterly basis, that the clerks report the number of people who've been committed. We need to keep up with this information in real time. The department is getting to where they can take that information and make it public. There also is a provision which sets up a fund. There's no money in it, but it sets up a fund for additional money to be made available to provide facilities around the state. And I think that touches most of the high points of the bill. The bill differs somewhat from the House bill because just as a matter of principle, you would have a bill with that many pages in it and not make some changes, but more practically, I think this puts in a position to look at the work the House has done, to look at these suggested changes. I don't think there's any great, huge philosophical difference between what the House did and the proposed strike all. It's just an effort to try to see where we might wind up when all of this is over. That may be a very lengthy explanation of the bill, but the bill has a lot of substance to it. And it, in my opinion, has a lot of actual provisions that are doable, that can be done, and will start showing an impact on the ground around the state. So having said that, are there questions? Senator Fillingate.
Thank you, Mr. Chairman. Just, I guess, a clarification question on the sheriff and the clerk. Are they to be voting members or non-voting members?
The bill that's before you, or the strike all, doesn't contain one of my last minute chicken scratchings that I provided, but it provides that the counties may, if they want to, appoint a clerk, sheriff, or a deputy. I'm told there are counties that want to put their chancery clerk or their sheriff on the commission, so they can do that. Separate and apart from that, there's a non-voting chancery clerk to be chosen by the chancery clerks, a non-voting sheriff or deputy to be chosen by the sheriffs, so that those individuals will not have a vote, but they'll just be there. So when you say what's going on at the clerk's office, there'll be somebody who knows.
Thank you. I think that answers it because I think there are two regions, maybe 14 and 15, that have two counties each. And I think the concern was whether if these were all voting members, is it for both counties?
No, they would not be voting members.
Thank you.
Anyone else? Senator Blackwell.
Thank you, Mr. Chairman. Who's paying for the training that these folks are going to go through? And do you know how much that's going to be?
I would assume that the local entities are paying for it. I think it's probably also provided by the state. I can get a better answer to that as we go along.
And then do you have any idea about the funding for the Department of Mental Health for them to contract with the hospitals?
I don't. I believe that would come up in appropriations.
Okay, thank
you. I would say it's my intent not to have any provision that puts a economic burden on someone that is unreasonable. So those are good questions, and get answers to that as we go through. Particularly if you remind me. If not, is there a motion? There's a motion title sufficient to pass as amended. Are you registered, ready to vote? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. We'll report that to the Senate. The next item on the agenda is House Bill 1264, which is a rather straightforward bill. Which simply says that school districts are authorized to make feminine hygiene products available if they choose to do so. The bill has a preamble. I sure would like for someone to move that we strike subsection 1, which is the preamble, and renumber other sections accordingly. Senator DeBar so moves. All in favor of that amendment, say aye. Opposed, no. The ayes appear to have it. As I say, the bill is a straightforward bill which does what it says. Is there a motion on the bill? Is the motion title sufficient to pass? Strike all. Questions? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. The next item on the agenda is House Bill 1299 regarding pharmacy benefit managers. I do not intend to call that bill up for a vote, but I thought the committee deserved an explanation, let alone the many people who are interested in the bill. We've been struggling with the issue of pharmacy benefit companies for some time. We had a hearing earlier in the session. We had a bill that was reported out with a reverse repealer. I took that to mean that what the committee wanted to do was to do something, but that the committee wasn't entirely confident with the specific proposals of what was before us. Since that time, there have been a number of concerns expressed about almost anything by employers. Well, although one might be somewhat cynical about concerns expressed by the pharmacy benefit industry itself, it does seem that the interest of the employers would align with the interest of the pharmacists and others that we're trying to provide drugs in a convenient manner and a reasonable cost. And those concerns, I think, are a concern, troublesome. I have read various proposals from the independent pharmacist. I'm not sure that I understand exactly what they would do, and personally, I'm reluctant with the caveat that I know enough to know that I don't always know what I'm doing, but I really am reluctant to bring something forward and be just completely without any confidence that I'm making an adequate representation to the committee. The House sent us a bill which would provide that the state of Mississippi make public some of its contracts and some contracts or arrangements with aggregators. On one hand, the state has these contracts. They can make them public if they want to. On the other hand, I can't quite figure out how that's going to get resolved. The question of, are we getting to the state all the rebates that are the state said to be due under its contract? So my thought is that we need to continue to look at this situation, but we've got to find some folks who know what's really going on, can explain to us what's really taking place, where the gotchas are, if there are gotchas, and what legislation that we might pass if that would help maintain the independent pharmacists that we have around the state and would help us avoid what I'm concerned about, which is more and more and more concentration in the healthcare industry among a couple of national companies, which in the long run, I don't think is good for healthcare. But we need to know what we're doing. And if we're going to do something and we're going to pass legislation, which may be controversial and have people of good faith telling us we're doing the wrong thing, we need to have a mighty good answer for the questions they may ask. I just don't feel that we're at this position. I can tell you personally, I've spent hours and hours on this, and I know the committee has too, but at the end of the day, I don't feel comfortable calling up the legislation at this time, and I'm not sure it does anybody that much good for us to do something that's not truly meaningful. So that's where we are. I believe that completes the agenda. If there's a motion to rise and report, Senator Fillingane so moves. All in favor say aye. All opposed, no. We stand adjourned. Thank you all for your work.